Imagine waking up to a world where your access to affordable health insurance hangs in the balance, decided by election outcomes and political standoffs. That's the gripping reality facing millions of Americans today as we unpack what the 2025 election results could mean for Obamacare's tax credits. Get ready, because this isn't just policy talk, it's about your family's well-being. Healthcare Insights. Sponsored by the Coalition to Strengthen America's Healthcare. The core focus: election night's impact on healthcare accessibility. Healthcare took center stage on election night 2025, delivering a powerful message to politicians everywhere. Democrats campaigned fiercely on the theme of affordability in crucial midterm elections, and their victories on Tuesday have left liberals energized. On Wednesday, progressive Democrats declared that these results should fuel their ongoing battle to prolong Obamacare's enhanced tax credits, especially amid the backdrop of a lingering government shutdown that some factions are eyeing as an opportunity to pivot. Picture this: Obamacare, formerly known as the Affordable Care Act, ACA, introduced these enhanced tax credits to help lower-income families afford health insurance premiums. It's like a financial lifeline, reducing out-of-pocket costs significantly for many households. For beginners, think of it as government subsidies that make health plans more accessible, ensuring that even if you don't earn a high salary, you can still get coverage without breaking the bank. Without them, premiums could skyrocket, leaving millions vulnerable. Senator Bernie Sanders, Independent Vermont, captured the sentiment perfectly on Wednesday, stating, "I believe one of the key factors behind the Democrats' strong performance is that voters recognize we're committed to safeguarding health care for all Americans." Senator Chris Murphy, Democrat Connecticut, echoed this, emphasizing that the party's stance on health care was rewarded at the polls. "It would be utterly counterproductive," he remarked, "for us to abandon the fight right away." But here's where it gets controversial. While some centrist Democrats in the Senate are exploring ways to end the government shutdown this week or the next, they're facing fierce resistance that might derail any deal. The proposed strategy involves approving a continuing resolution, a temporary funding measure to keep the government operating, to secure a promised vote on renewing those subsidies. And this is the part most people miss. After such resounding Democratic wins, progressives argue that offering this compromise would be like handing Republicans a victory on a silver platter. Instead, they say, it's time for Republicans to step up to the negotiating table, not for Democrats to throw them a lifeline. A mere pledge for a vote, without a concrete agreement that could become law, is a tough pill for many Democrats to swallow. As Sanders pointed out, "I'm aware of talks about bipartisan discussions. Let me be crystal clear. If these talks result in actual legislation extending the ACA's tax credits, I'm all for it. That's fantastic. But there must be a real commitment. If it's just a bill that squeaks through the Senate with 50 or even 60 votes, what then? It ends up as nothing more than a hollow promise." Welcome to the Hill's Healthcare Newsletter. I'm Nathaniel Weeksel, and I'm joined by Joseph Choi. We dive into the latest developments shaping Washington's influence on your health, week after week. Key updates, policy shifts affecting healthcare this week and beyond. Let's delve into how current policies are reshaping the healthcare landscape. President Trump recently pledged to assist Scott Adams, the creator of Dilbert, who appealed to him for help with his cancer treatment. "I'm on it," Trump posted on his Truth Social platform. This highlights ongoing debates about presidential involvement in personal health matters, raising questions about the balance between celebrity influence and equitable healthcare access. Meanwhile, Florida's decision to eliminate public school vaccine requirements starting next year has struck a chord with parents like Elizabeth. Her 11-year-old daughter battles a rare immunodeficiency disorder, needing biweekly plasma infusions for disease protection. Yet, the girl can already miss up to 50 school days annually, and Elizabeth fears declining vaccination rates could worsen their challenges, potentially exposing vulnerable kids to preventable illnesses. Is this a step toward personal choice or a risky gamble with public health? It's a debate sparking strong opinions. Share yours below. A note from the Coalition to Strengthen America's Healthcare. Healthcare that never stops, whether on rounds or on call. Urge Congress to safeguard round-the-clock care, because when the doors shut, it's too late. Over 300 hospitals are now on the brink of closure, jeopardizing vital emergency services. Discover more and take action here. https://strengthenhealthcare.org/our priorities/Medicaid/UDM source equals newsletter angitum medium equals hill angitm campaign equals healthcare angitum equals clock attend email equals cbc7c mail equals a60s. Additional highlights. Switch things up with a fresh story from the Hill. From a handful of participants to over 350, kids and their guardians are teaming up for school commutes via bike bus in Montclair, New Jersey. On a bright autumn morning, helmet-clad children and parents assembled in a local shopping area, guided by volunteers in orange safety vests. Before pedaling off to two nearby elementary schools, everyone ensured readiness. National Roundup. State and local headlines in healthcare. A brutal assault on an ER nurse sparks fury among Pennsylvania healthcare staff who are demanding better safety measures. https://www.com/article/violent attacker nurse outrage pa healthcare workers protection email equals cbcb7c and email equals a6 and MILB. Authorities challenge Dr. Mehmet Oz's statements on Oregon's expenditures. The Lund Report. https://www.thelundreport.org/content/state disputes Oz claim about Oregon spending email equals cbc7c and email equals a6 and MILB. Mississippi Governor Tate Reeves unveils a rural health initiative to secure federal funding. Here's what you need to know. The Clarion Ledger. https://www.clarionledger.com/story/news/Mississippi Gov Reeves submits rural health plan for federal money /email equals cbcb7c and email equals a6. Our reading list. Noteworthy health stories from around the web. Amid political finger-pointing, these physicians strive to remove stigma from medical errors in training. KFF Health News. https://kffhealthnews.org/news/article/shame competence medicine doctor training email equals cbcb7c and email equals a6 and MILB equals Phoebe. Obamacare remains on President Trump's radar, though prospects for change look bleak. Roll call. https://olllc.com//Obamacare is still on Trump's mind but outlook appears doubtful email equals cbcb7c and email equals a6 and MILB equals a. Appellate judges expressed doubt over the Trump administration's justification for limiting NIH indirect cost reimbursements.
Stat. HSWW Statnews.com 2025 1105 indirect cost la Suitar Guet Federal Appeals Court ML 46777777777 Email 1226 de 4069 de 56742 Email 0545 de 7403 71797 de rece 44 0077 ca 5 3 AUTM Sorce Sail Tru AUTM Medium UTM Campaign 11 05 25 20 Healthy 20 Carei 20 Geceno 20 ASI 20 Fori 20 CMS.
That's the wrap-up for today. Catch you next time. Stay informed on the latest in politics and policy. Subscribe to the Healthcare newsletter for direct delivery to your inbox. Tags: 2025 elections, Affordable Care Act tax subsidies, Bernie Sanders, Chris Murphy, Obamacare, Shutdown, Tate Reeves. Copyright 2025 Nexstar Media Incorporated. All rights reserved. This material may not be published, broadcast, rewritten, or redistributed. What do you think? Should Democrats push harder for a solid deal on tax credits, or is compromise with Republicans the smarter path? Do you agree that vaccine mandates are outdated, or do they protect our communities? Share your views in the comments. We'd love to hear from you and spark a conversation.